Welcome back to the Exam Room Podcast. Over the last 2 episodes, we've explored the growing challenges surrounding patient education, medication management, health literacy, and care coordination in today's healthcare system. Geneva Miller, founder of Equipped Healthcare Solutions, shared powerful insights on why traditional patient education methods often fall short and why healthcare organizations must rethink how they engage and support patients beyond the exam room. In this final episode of the series, the conversation turns to high-touch care and what healthcare systems can learn from more personalized care models. From caregiver burnout and chronic disease management to medication reconciliation and post-discharge follow-up, Geneva discusses the importance of compassion, communication, and continuity in improving patient outcomes. Together, Dr. Rhiannon Winsor and Geneva Miller explore what it truly means to support patients and families, not just clinically, but humanly.
We're back in the exam room with Geneva Miller to continue our discussion about medication education and care coordination. I want to talk about what high-touch care teaches us in your experience. We had a previous conversation, you and I, where you had mentioned a dementia-focused nonprofit, I believe, where the patient's initial visit is literally 2 hours long, and they only see a handful of patients a day, as far as the provider goes. Is there anything that traditional healthcare systems can learn from models like that?
I believe that, so for value-based care, again, not saying one thing is better than the other. For those who use the systems that they have and they optimize their workflows, I believe I've worked with very good value-based care providers. So as long as we're working what we have, then it could work. It can have a beautiful outcome. But for the high-touch personalized care, especially for disease processes where the caregivers are burnt out, I think caregivers all over the world it's a heavy load to carry. But when you think about high-touch personalized care or high-touch care when it comes to dementia patients or cognitive issues, it's very hard to see your loved one go from sweet to now angry and bitter, or they don't recognize who you are, or they're trying to get out and go somewhere, and it's like I'm trying to keep you safe, but they don't really understand. So that time allows the caregiver to feel as if they're a part of the journey, which they are. They're basically an unpaid worker. And because again, what they would do, a personal care companion would do, a CNA would do, a nurse would, like, people are nursing their parents back to health. They're giving medications, they're trying to live their lives as well. So they're doing double duty here. But when you think of spending 2 hours with a person, that's the education we were talking about that was missing for the people who keep coming in and out of the healthcare system, because I get to have possibly a video, right? If I know that, for example, when I was doing education with my dialysis patients who decided to do home dialysis, remember, all of the toxins that they would normally urinate out is still in their bloodstream. So now they're tired, but they had a companion with them that was listening to those videos, right? They had a companion with them, and I could say, hey, do you have any questions about this? What do you think would be a better way for your husband to learn or for your mom to learn? So when she wakes up or when you get home, you can explain to her this way, this is how the process works. Because some people do have caregivers, but they still don't understand. So that 2-hour visit, it makes them feel as if we care about them.
Yeah.
It makes them feel as if we care about them. Even when you go out and somebody holds the door for you, it's still a form of a courtesy. It makes you feel as if you're respected. In 15 minutes, I can't teach you anything. I'm trying to teach a 5-year-old something in 15 minutes. Their attention span's gone. So when we have a 2-hour visit, I'm able to ask you questions. What's the dynamic in your home? What things do you do on a daily basis? What things do you like to do? What did mom do before? Blah, blah, blah. I can get a baseline of the family's history, and then I can now move forward with education that can be tailored to them. So now I can meet you where you need to be met for this visit, but remember, you're going to come back in a month or two, and now we're going to have another hour-long visit because I need to check in. I need to figure out what went wrong, what went well. Is there a portal that I have where you can send me a message and I get back to you not a week later? Like
Hmm.
I'm really, I have the time to check in. So there's a cap there. I can't see more than 7 people a day because the quality of the care that I want to give determines that. Every place get to be this way? I don't know, but I I pray at some point we can see the value in it. I'm
Hmm.
sure there are people who want to donate to, like for myself, when it came to my mother having esophageal cancer, I wish that I had known a little bit more about it. I wish that I had known other ways to treat outside of chemotherapy, but where was the education, right?
Yeah.
So, and there probably is some out there, but where can we have that education hub where we have these things people can come in and learn? We need that somehow, some way, so that we feel as if we understand and we can become our own advocates.
Hmm.
That's another thing that I would love for my family. Families need to be able to, what if I'm not there, or if I can't be there because of whatever reason, you have this packet of information. Here are questions you're going to ask before this appointment or during this appointment. We're going to ask these questions and then ask them to explain it to you. We say, okay, I understand, but we really don't, because sometimes you don't want to be feel like a burden, or I know you got to get on to the next patient. But that
Hmm.
high touch care gives the family the opportunity to ask questions.
Absolutely. And I think that's, the seeing 6 or 7 patients a day in most instances, I don't think that that is practical at all. It's not happening. It's not realistic as long as we're focusing on this fee for service type model, because that's the more patients we see realistically, the more revenue we generate, right? So, um, I think that's where that idea of like coordinated care comes in. And if the clinician, the provider, can only spend X amount of time with the patient, their focus is diagnosing and treating, then we need
Yes.
somebody else in that space that can spend the 2 hours, that can like you said, do those things that in that space of the actual visit just can't happen.
Mhm. Yes, and that's exactly why, um, when it came, even with the programs that I was in with my previous employer, the care coordination piece was the heaviest. Right after you get discharged from the hospital, we got 24 to 48 hours to reach you. And then I'm going to call you within the week. And then I'm going to call you at the 2-week mark as well, because I want to make sure you coordinated care. So now locally, this is what we strive to do. Because again, now on my end, we're starting preventatively, but we will have patients, or we do have patients who have a disease process, maybe one or two, and they need some care coordination, but we're doing that locally. But again, the amount of people, the amount of seniors in the world, we're not going to be able to reach everybody,
Mm,
right? So we have to start somewhere. So like you said, if I can't have the model where I'm only seeing 7 patients a day, then I have care coordinators.
mhm,
Somebody is reaching out to my patients and following up when I cannot, even if it's somebody who is a consultant. This is Mr. Jones. He's my private client. I'm giving you these notes because this is what he said. Can you take a look at it? Let me know if there's anything you want me to relay back to him. Not in competition, but we want to work together. We work better
mhm.
together.
Absolutely. Very, very well said. We work better together. I love that so much. And at the end of the day, I remember having a conversation with my CEO, and I was saying, well, hopefully we all remember that at the end of the day, everything that we're doing is about the patient,
Hmm. Yeah.
and I don't know if there's any other industry that's more highly regulated than healthcare, and I understand we have to work in the confines of that, but not losing sight of like there's a human that's relying on us, and empowering the patient as well. I think is something also very important for us to remember.
Yes. I think the last thing that I would say is a little bit of a charge, but more of take a moment, after you listen to the podcast and just sit back and think, when was the last time I tried to help a patient deprescribe? A
Mm,
lot of our seniors are, we have a lot of polypharmacy, right? So I'm taking more than a certain number of medications. Last time I looked, it may have been about five, but I'm taking more than five medications. And, as they age, or anyone taking a whole lot of medications at the same time, the effect of this one may outweigh the other. So if I'm not deprescribing, am I educating about the timing of these medications? If
mm,
I'm not deprescribing, do I reconcile every month when my patients come in so that I can look at their med list and ask them, are you taking this? I know I'm not your primary care provider, but I might be the only provider that you see. So I just, want to, even if the nurse does it, and checks off, they're taking this, they're not taking that, and then you go through it during the appointment. And with the value-based care and, care coordination, we can work together without feeling as if, someone is trying to point the finger. The reason why Equipped Healthcare Solutions was built was because even as a nurse, I felt like I was ill prepared when my mother went to chemotherapy. So
mm.
if me as a nurse feels some type of way, and I went to school, we had to take state tests so that we can safely help patients. I
Yes.
I felt like I was out of the loop.
Mm,
And imagine someone who's never been to any kind of healthcare seminar, nothing. So we have to remember that when our patients come in and they're scared or they're frustrated, their family's frustrated, they don't know what we know, and they may not understand the things that we have been privileged to understand. So I think that's the last thing for me is, if I am working with my patients, have I served them well? Have I served them well?
This has been such an important conversation because it really does challenge us to think differently about what patient education and care coordination really requires. I so appreciate how you brought the human element into our conversation today. I think because of all the rules and regulations, sometimes we forget about that human
Mm,
element. And I think it's really easy for us to say education matters, but building systems that
yes.
truly support patient education, adherence, that and quality of life is much more complex than we give it credit for. So, thank you for sharing your experience and your perspective on where healthcare organizations have an opportunity to rethink how we support patients and families beyond the clinic visit.
You are more than welcome. I'm just very excited that I found you on LinkedIn or vice versa. Either way, I was very excited to be here.
Thank you for joining us for this final conversation with Geneva Miller here in the exam room. Throughout this series, we've explored the realities of patient education, medication management, caregiver support, and care coordination, and the importance of building healthcare systems that truly meet patients where they are. Geneva reminded us that education is more than information, that care coordination requires collaboration, and that every interaction in healthcare is ultimately about serving people during some of the most vulnerable moments of their lives. We hope this series sparks new conversations within your organizations and communities about how we can create more compassionate, connected, and patient-centered care experiences. Be sure to subscribe to the Exam Room podcast on YouTube, Apple Podcasts, or wherever you listen, and stay tuned for future conversations shaping the future of healthcare. We'll see you next time in the Exam Room.